folks another minute or so to join us, and then we're going to get started. If you will, place in the chat your name and city. We just want to know who came out to be a part of this event with us, so I can give some city shout outs. Okay, let me see who we got. All right, Chicago, I see Houston, New York, Mississippi, oh, home state, Georgia, Maryland, Tennessee, oh, wow. From everywhere, Dr. Leo Moore, Los Angeles. Welcome, Dr. Moore, San Francisco. New Orleans. Oh, welcome, welcome. I see the real home state for me, Florida, showing up big for Nicole and I. Well, I'm not gonna steal that thunder. All right, welcome, 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 everyone. I hope that you hear from the sound of my voice. I am so excited about this webinar. I've been excited because it is such an honor to share this space with these amazing researchers who are Black women who are doing research on the populations that they represent. And so often we don't get a chance to see researchers who are reflective of those audiences. So I am Leisha McKinley-Beach. I am a member of the Atlanta Black Women Leaders on PrEP. And Nicole, next slide. Just a little bit about the Atlanta Black Women Leaders on PrEP. It's a coalition of women that came together in 2017. We were all having some challenges and some frustration around seeing what was happening with PrEP in this HIV space and women not being prioritized. Being from a city like Atlanta, it was very clear that we needed to do something to address PrEP for Black women. And so we came up with this coalition with a goal to raise awareness about PrEP. So many of the women that could benefit from PrEP didn't know that it was for Black women, didn't know that it was for women. And so these researchers, advocates, public health professionals, individuals who had made a decision to have PrEP as a part of their HIV prevention strategy. We've all come together in the past couple of years. We've truly been focused on both raising awareness and giving platforms for folks to see the important need for us to center Black women as a part of this conversation. So I reached out to my dear friend at NASTAD by way of Florida. We are two orange girls from the Sunshine State, Miss Nicole Elenoff, and I shared with her what we wanted to do and would love this partnership with NASTAD to be able to bring this type of webinar to our HIV space. And she didn't hesitate to say yes. And we're so honored to have her and NASTAD as a partner for this very important discussion. So I'm going to turn it over to you, Nicole.
Thank you so much, Leisha, for that really great overview and just for this partnership in general. It's been such an honor and pleasure to work with you over these several years, and glad we could do this webinar today. So as Leisha mentioned, my name is Nicole Elenoff. I use she, her pronouns, and I am on the prevention team here at NASTAD. For those that don't know, NASTAD is an association of public health officials that administer HIV and viral hepatitis programs. We're also the technical assistance provider for the phase 1 EHE jurisdictions. Our mission is to advance the health and dignity of people living with and impacted by HIV/AIDS, viral hepatitis, and intersecting epidemics by strengthening governmental public health and leveraging community partnerships. And our vision is a world committed to ending HIV/AIDS, viral hepatitis, and intersecting epidemics. We are really excited to get started with hearing our amazing presenters, and just wanted to go over some brief housekeeping items. So you are currently on mute. Please stay on mute. We have some incredible speakers that we do not want to miss. And if you have any questions throughout the presentations, feel free to put them in the chat, and we're going to have some Q&A at the end. So I'm excited to introduce our first speaker, and that is Christian Spears. So Christian Spears is a native of Slidell, Louisiana, but currently resides in Atlanta, Georgia. Christian has over 10 years of public health and social work experience. She has worked as a counselor in a local health department Currently, she works at the Centers for Disease Control and Prevention in the Division of HIV Prevention as the lead for the community-based organization's flagship Notice of Funding opportunity. Christian is currently completing her Doctor of Public Health at Georgia Southern University with a focus on public health leadership. She is completing her dissertation and is preparing for defense this fall. You got this. When she's not busy with work or school, she enjoys traveling, cooking, and completing DIY projects. More importantly, Christian strives to be a leader who inspires change and motivates others to see the world through an equitable lens. Welcome, Christian. So I'm gonna stop sharing, and over to you, Christian.
All right, let's get started. Show my screen. There we go. Can you guys see my screen?
Yep.
All right. So thanks, Nicole, and good afternoon, and welcome again to For Us, By Us, Black Women Scholars on PrEP. I'm Christian Spears, and I'm very humbled to present my study to you today. I will provide data from CDC, but the views in this presentation is not representative of the agency. Here's just the outline of the presentation that is listed on the slide, but I'll get right into it. Here's a little background data extracted from CDC's 2019 HIV surveillance report. Black African-American persons account for 44% of new HIV diagnoses. However, Black women represent 58% of the 245,000 plus women living with a diagnosed HIV infection in the United States. 1 in 9 women is unaware of their HIV status, as well as their partner's risk factors for HIV. The largest rate of diagnosis of HIV infection among Black African-American females was in the Southern region with 24.6 per 100,000 and 23.5 per 100,000 in the Northeast region. Black women also have a 14.6-fold higher risk of acquiring HIV compared to their counterparts. So here are a few more statistics to explain the statement of the problem. Overall, 80,000 people in the United States are on PrEP, yet only 1% of the Black people who could benefit from PrEP have filled a prescription. PrEP awareness among women in the United States is believed to be between 10 and 20%. PrEP initiation is lower among women than men and significantly lower among African-American women compared to white women. It has been cited that PrEP uptake remains low among Black persons due to misinformation, low levels of awareness, stigma, and limited access. So we all know that African-American women do not bear the largest HIV disease burden. So the numbers may hinder us from it being brought to the forefront. However, the literature has evident gaps regarding women, HIV, and PrEP. There is some literature that assess the specific dynamics of this issue, such as the examination of trusted sources of sexual health information for African-American women, awareness of PrEP, PrEP knowledge baseline levels, understanding of their attitudes and beliefs toward PrEP, and psychosocial factors associated with willingness to take PrEP. However, few studies examine these factors among women, let alone African-American women. And if this is the case, there is a need for those research gaps to be filled with either survey or interview or focus groups that can identify and address barriers for PrEP for African-American women. So that's why we're here today. With this knowledge, the SHE-PrEP study came into conception, examining the influence of the messaging and the messenger associated with PrEP uptake among African-American women. This research is significant to me because it is an intersection of my personal and professional life. I'm an African-American woman who works in HIV prevention and want to see prevention methods that are engaging for all, including those we serve who look just like me. That is why research for us must be conducted by us. So here's a picture of the dream team members of my dissertation committee. Committee members include Dr. Betty Appentain and Dr. William Mace, but a special shout out goes to Dr. Stacy Smallwood, who is my committee chair, who keeps me grounded and focused on developing research that truly matters. So this study aims to assess awareness, perception, and receptiveness toward PrEP among African-American women. This study intends to identify critical factors that would inform more culturally sensitive and appropriate health promotion from providers for persons at risk of acquiring HIV. You may ask, why is this study important? I'm glad you asked. This study is not only important, but significant because it will provide an intersectional awareness of multi-level factors that influence an African-American woman's decision to prevent HIV by considering PrEP. However, with limited research geared toward African-American women, the findings have been small and hard to generalize. Therefore, this research will identify individual and social barriers that can inform HIV prevention efforts and structural interventions for African-American women. It will also offer insight to public health professionals, clinicians, and sexual health educators. One unique factor in this study is the integration of previous themes in literature with one of the most critical themes in marketing, the message and the messenger. So PrEP was approved by the FDA in 2010, and these are some of the initial campaigns that were used to introduce America to PrEP. Looks familiar? But in 2023, I'm happy to say the campaigns are starting to look different, and they're starting to speak to other demographics and medication options. Here are a few examples from DC Department of Public Health, CDC, Louisiana and BAI, and the list continues. So for this research method, quantitative research was chosen for the design because it utilizes deductive reasoning, which is better suited for determining large population attitudes, practices, and opinions. An electronic survey was selected because it allows for concise, anonymized, and a uniform way to disseminate and answer the research questions. The inclusion criteria for this study participants are as follows. Identify as a woman, regardless of sex assignment at birth, so that's by birth, or a trans experience. Must be an adult ages 18 and up. Identify as an African-American Black woman. Must reside in the United States. Have an HIV negative status and have had vaginal oral sex in the past 12 months. This instrument was developed by utilizing Qualtrics software as a survey medium. The questions in the survey were extracted from previously published surveys that proved reliable and valid. As it stands, the survey includes questions that assess factors in the research questions. An informed consent statement is located at the beginning of the survey. If one continues with clicking the link and completing the survey, it signifies consent. This survey should take approximately 15 to 20 minutes to complete based on your PrEP knowledge. And this study was also approved by Georgia Southern University IRB, and it has been amended to add more marketing on social media. The best part of completing this survey, and I often forget to say, is that you have the opportunity to win a raffle, one of $500 gift cards by signing up on the Google link at the end of the survey that is separate. So take a chance, bring an opportunity, and also help with research. So here's just a table, and I know it may be hard to see on the screen, but here's a table that just represents the scales utilized in the survey from previously published studies that include sources of PrEP information, awareness, beliefs, willingness, and factors that are significantly associated with willingness. But what's unique about this survey, that there are qualitative questions that will pertain to messaging and messengers for further analysis. So in closing, the ShePrEP study data collection began in December 2022, and I am excited and thrilled to say it will be closing at the end of this week. It has been a long journey, but I'm grateful for the support and the interest many have taken in Black women and PrEP. So thank you today for your attention, and my contact information is on the slide. But more importantly, there's a QR code that I need you to click on if you meet the inclusion criteria. And if you do not, no worries, share with someone else who does so that we can provide research for us and by us. And now I'll turn it back over to Nicole to introduce our next presenter.
Thank you so much, Christian, and can't wait to hear more about the findings that come from this research. So yeah, very exciting. Let me quickly transition our screen, and I'm excited to introduce our next speaker, who will be Courtney. All right, so all right, so very excited to have Courtney Peasant-Bonner joining us for our next presentation. She's a research clinical psychology at RTI International, where she works in the Substance Use, Gender, and Applied Research, or SUGAR program, to adapt and evaluate women-focused HIV prevention interventions. Dr. Bonner has worked to decrease HIV disparities for over 10 years. Her research focuses on understanding the impact of substance use and mental health on HIV risk and developing sustainable interventions to address these factors to reduce health disparities among women. Her current research projects aim to integrate reproductive health, mental health, HIV prevention and treatment, as well as substance use services for people in the US South and South Africa. Dr. Bonner earned her bachelor's degree from Florida A&M University and her PhD from the University of Memphis. She completed her postdoctoral research at Yale University Center for Interdisciplinary Research on AIDS. Welcome, Dr. Bonner. And I will stop sharing so you can share your own slides.
Thank you so much, Nicole, and thank you so much, Alicia and Nicole, for inviting me. It is always a pleasure to share the stage with such wonderful sister researchers. So with that, I will get started. And I'm just going to be sharing some of my most recent research from what we like to call the Empower Project, which stands for Educating Medical Providers on Women-Controlled HIV Prevention to Expand Reach to African American Women in Atlanta. And this research is funded by the the National Institute of Allergy and Infectious Diseases through the UNC CFAR. And I also like to acknowledge that this funding was part of the Ending the Epidemic. So this is my lovely team of researchers. This study is a collaboration between RTI, Sister Love Incorporated, and UNC. And I like to take a moment while I'm acknowledging my research team to also kind of acknowledge, similarly to Christian, like why this work is so important to me personally. So I whenever I talk about the study, I always talk about kind of how it's me search. And I think sometimes we want to be super objective and away from the research, but in this case, this is research that is really personal to me. And so this research idea really came to me as I was new to the Atlanta area and looking for a doctor. And upon visiting my doctor, who I kind of landed on, who was a Black physician serving Black women in a largely Black county, I asked for if they had PrEP. And I was quickly told that they didn't provide PrEP. And so this practice has 3 offices. And so I went to the next office and asked, and I was told, no, we don't provide PrEP. And then I went to the last office, and that was the only office that told me where I could get it, but still didn't make a referral. And so I thought that that was just a really large missed opportunity, particularly in a place like Atlanta, particularly in a county that's majority African-American, and in an OBGYN setting that sees lots of women of color. Because what we know is that women of color are more likely to acquire HIV because of all the social determinants of health that we engage with on a daily basis. And so the opportunity came to compete for funding to address HIV prevention among women in the South. And I felt like it was a sign from heaven and I needed to pursue this work. And so we wrote this proposal with these 3 aims: to engage the community in focus groups, in interviews with providers to understand kind of what women's experience and awareness was related to PrEP, and what providers' experience and knowledge about PrEP was like, and then to develop a training specifically for providers to help them feel comfortable providing PrEP to Black women. And then to test the training and to see if it had any preliminary impact on providers' knowledge of PrEP, their confidence to prescribe PrEP, and then ultimately their provision of PrEP, particularly to Black cis women. And so in order to engage in this work, we did a lot of community engagement at the outset. Sister Love coordinates our community collaborative board and was amazing at bringing a lot of people from a lot of different communities together to talk about this issue. We then conducted focus groups with 22 African-American women, and I'll share the findings from those focus groups today. And then we did interviews with providers guided by the Consolidated Framework for Implementation Science or Implementation Research, or CFR, which is an implementation science framework. And then we did rapid qualitative analysis of the information that we gathered, and then using a user-centered design kind of methodology, designed a really interactive training for primary care and OBGYN providers serving Black women. And then we are assessing the outcomes of that training using a crosswalk that is was developed and is housed by the Implementation Coordinating Center out of Northwestern. And so I just make a plug for that, because if you're interested in doing HIV research, it's a really great resource. And so this graphic is a little fuzzy, so I apologize, but I love to just highlight the diversity of the women that we engage with for this study. So most of the women who participated in our focus groups were single and most of them actually had private insurance, with about 57% having private insurance, 15% having government issued insurance, and 24% having no insurance at all. And then these were women in the Atlanta metro area. Most of them were from Fulton County, followed by DeKalb County, Cobb County, and then Gwinnett County. And then the average age of the women who engaged in our focus groups was 33, and 68% of the women who engaged in the focus groups had a college degree or higher. And so here are just some highlights around what women knew about PrEP and what they thought about talking with their provider about PrEP and getting PrEP. So women generally did not really know about PrEP, but really thought that if they were going to talk to anybody about PrEP, it would be their primary care physician or their OBGYN. But they were hesitant about how they would know it was kind of safe to talk about about PrEP with their provider. So for example, one woman said that if it's not advertised in some way, she may not feel comfortable asking her provider because she doesn't know whether or not the doctor is aware of the drug or if they would feel confident providing that drug to her. And then when we asked women about where they would go for PrEP, the majority overwhelmingly say their OBGYN, that would be the best place for women, particularly if a woman has insurance, and that they would be open to telemedicine or getting PrEP via telemedicine because it would reduce kind of the awkwardness around talking to the provider about PrEP. But then there were also some considerations around privacy and kind of that personal touch that you get when you're in person with a provider. And then when we talked about if women would be interested in actually taking PrEP and what they thought about the adherence of PrEP, women overwhelmingly said peace of mind was probably the biggest benefit that they could imagine that PrEP would provide, but that there were concerns about price. And I think we are seeing this kind of bear out in the real world as we talk about insurance coverage for PrEP, but price was a huge concern for women. And then when we talked about adherence, they were thinking that, it wouldn't necessarily be a problem for some women, particularly women who are used to taking a daily pill, like maybe the daily birth control pill or another type of medication, but that it could be challenging, but doable. And then when we talked about oral versus injectable PrEP, many women thought that injectable PrEP would be a much simpler way of taking PrEP. But we did have a couple of women who said that oral PrEP would be nice because they could kind of control the extent to which the medicine was in their body. And so we thought that that was a really interesting insight. So we took all of this information that women gave us and we created a training for providers based on kind of what the women said that they would want their providers to know and be able to discuss with them related to PrEP. But I'm not going to go through every slide for the sake of time, but I just wanted to give you all an idea of what this training was like. And if any of you all are interested in it, please feel free to contact me after the presentation. But essentially, each provider goes through a pre-assessment, and then based on the answers of their pre-assessment, they are guided to 6 different modules, depending on their existing level of expertise. So the first module focuses on the epidemiology of HIV among Black women. The second module talks about the basics of PrEP. The third module talks about how to initiate a patient on PrEP and how to get reimbursed for PrEP services. The fourth module talks about the follow-up visits that occur once PrEP is initiated and how to manage side effects and serial conversion. And then the last module is related to PrEP and pregnancy. Then once the providers go through the training, they take a post-assessment, and then if you are a provider and you want to take the training and you pass, you'll receive 3 continuing medical education credits. So the take-home message really is, and I think Christian did a beautiful job illustrating this, that the narrative related to PrEP is still overwhelmingly male-focused, although it is changing, thank goodness. And Black women are interested in taking PrEP and really value the recommendation of their providers. And so it's really important that OBGYN and primary care providers are educated about providing PrEP to their Black female patients, because they're really in an ideal position to offer PrEP to Black women. I'd like to acknowledge all the participants who took their time to engage with our study, our funders, the Substance Use and Gender and Applied Research Group at RTI, as well as the University of Alabama, Birmingham Implementation Science Hub, and my femtor, Wendy Wexberg. Thank you.
Thank you so much, Courtney. Just hearing both you and Christian present, seeing two different ends of the spectrum, from educating Black women to educating those providers who are serving Black women. And so I really appreciate being able to see that all the onus is not just on the end user, but we're also providing some education and accountability for providers as well. I am not going to take up too much time because I want to make sure that our participants get a chance to hear from our next researcher. This is someone I truly adore. I adore all three of them, by the way, all members of the Atlanta Black Women Leaders on PrEP. So you already know it's a dynamic group because you're getting a chance to see three amazing women from the group. But I want to introduce Dr. Brittany Williams. She is an assistant professor of higher education and student affairs administration at the University of Vermont. She's a 2022-2024 National Academy of Education Spencer Postdoctoral Fellowship awardee, exploring Black college women and HIV/AIDS in Metro Atlanta. As a higher education scholar with interdisciplinary research agenda, I can't speak today. Her scholarship and personal professional advocacy focus on the nexus of education and health, particularly health disparities and equity. She explores Black women's career development and supervision experiences such as classism and identity development in higher education contexts within her primary professional context. Dr. Williams has been featured in and by the White House Initiative on HBCUs, the U.S. Department of Health and Human Services, AIDS United, the National Black Women's Health Imperative, and then and NMAC, and then a host of academic journals. I will say that what I know personally about Dr. Williams is her passion and dedication for this particular topic, and the passion that runs so deep for Black women's health overall. So Dr. Williams, I'm going to turn it over to you.
Thank you so much. Let me get my screen sharing going. Okay, can we see the screen?
Yes.
Perfect. All right. Thank you so much for reading my bio. I'm trying to stop being weird about having my bio read and listening to all the things that I do, because it doesn't really feel like work when it's something that you're passionate about and you care about. So again, my name is Britt Williams. I'm a higher education scholar. So I'm coming at the entire PrEP conversation from a completely different realm and lens than most people, because everything that I do, the work that I center on, and the context that I care about most are educational environments, because I believe they have the possibility and the power to transform Black women's experiences and the experiences of Black girls. So I think about my research and my work as sort of how I shift the narrative around what we're talking about when we think about PrEP access and we think about even the conversation on HIV. So I tend to do that by focusing on sort of the danger of a single story, right? So how do I render visible Black college women? And I focus on them because that's my research sort of demographic. I went to college, I had a good time, and I never left. And so studying college women is a way that I can sort of stay in this world that I care about. But for me, it's also thinking about Edwidge Danticat's call to sort of create dangerously, right? And so in this book, Danticat talks about creating dangerously is for people who read dangerously. And this is what it means to be a writer. Writing, knowing in part that no matter how trivial your words may seem, someday, somewhere, someone may risk their life to read them. And so I think about my sort of privilege as a researcher. I'm a first-gen college graduate. I grew up in a low-income family. I'm sort of the cousin or sibling, if you will, who made it. And what is my social and moral responsibility to do something with all of the information that I have and that I've acquired? And so I position my sort of work on Black college women and HIV/AIDS as part of that, because I entered this conversation as a personal PrEP user, as someone who fell in love with a man who was living with HIV. And so while my relationship has not outlasted my PrEP usage, the knowledge and the information that I acquired has become a big piece of me, who I am, and how I want to sort of contribute to what we're thinking about. And so I think about college context as a particularly important space because there's very rarely anywhere where you have a captive audience and they have to listen to you. I don't know how many of y'all have been on a college campus lately, or if you understand, right, if you are in a residential campus in particular, where you have to go to these res hall meetings, or you have these spaces and places where you have to show up and you have to participate in things. That's an opportunity for us to share information or to think about how we do passive information sharing to students who may not otherwise be thinking about these things, right? I've been working with college students since I was one at the age of 18. And one of the things that constantly comes up in the research, in the literature, and even in my own conversations with students is this false sense of security and safety that happens on a college campus because we're all students, or we're all the same, or we're all whatever. And that is not necessarily the case, especially when we're talking about health, when we're talking about wellness. And so I've also been interested in this because while Black women, represent about 58% of those who are living with a diagnosed HIV infection, we don't have any disaggregated data on how many of those women are in college, how many of them acquired HIV or have been in contact with people who are living with HIV on a college campus. We don't have enough campus programs that are designed to support people who are living with HIV, let alone those that are about prevention, unless they're on a campus where there's a scholar who's studying PrEP. Right. So I think about the relationship between Iowa and Southern University, unless there are folks who have a PrEP clinic or are doing some of this work. So it's very sporadic and sort of disparate how we are framing and sharing information within this environment. So for me, when I finished my doctoral degree in 2019, I started to think about what is it that I'm passionate about? What do I care about? For me, that's always helping enhance and transform Black women's lives. Everything that I do is not only for myself, but for other Black women. Lift as we climb has been my mantra since I was a younger person. I'm still young. Hold on. A younger person. And so I thought about, this is a way that I can sort of bridge this divide and this gap in between what people think of as public health, even though public health is interdisciplinary, but also for me as someone who's focused on what students are learning, how they're developing, and how they navigate the college environment. So I have sort of 3 ways that I've been doing this over the last couple of years. The first one is already published, and I promise there is a QR code with information where you can get all of this. And it was a content analysis project I did with a graduate student on the amount of HIV/AIDS research that has been published in higher education journals. And as an academic and an education scholar, I focus specifically on this because I know I'll find research on HIV and public health, and I know I'll find it in journals that are about medicine. But what are we actively saying in education about this versus how much of this are we allowing public health people to have conversations about that may not come from the same lens or approach or practice that we might take as educators? And so I've taken that, and I'll present a little bit on that, and started to also look at Black women and HIV/AIDS in higher education and what's been written on that. Long story short, not a lot. Not a lot. God bless, Rashida Chandler and some of these other people who are helping to create some of this work, but there's simply not enough data and information for us to even have a full picture of what college student knowledge looks like on PrEP for HIV prevention. The study I'm actively running right now, which I'll also talk about, is a sister circle study on Black college women in Metro Atlanta. I'm actively recruiting participants, and I'll have a link to that study as well. I'm having trouble getting participants involved from the HBCUs that I'm looking to engage, but the PWIs, they've been showing up, showing out. Shout out to Georgia State University. Their students are super interested in this project and want to be a part of it. And I'm excited to share sort of the knowledge and information that they have. And the other piece is a film short, which we just wrapped and we are in post-production for, where I'm sort of trying to tell the story of what do we know about Black women in PrEP? What do we know about young people in PrEP? I started initially thinking about wanting to tell the story of college students, but I thought we don't even have a story on Black women generally about PrEP. So maybe I should start there before I narrow out. And that piece will be coming very, very soon. So this is my current project team of collaborators. I have been lucky enough to rope Leisha into being stuck with me, even as she's on her way to retirement. So I have some graduate students, some co-authors. I also believe in sort of meaningfully engaging people who are living with HIV/AIDS. So Masonia Trailer is my ride or die homie who has her own sort of organization that she's doing, and she sort of helps to transform the lives of other women who are living with HIV. And she's been a big piece of this and helping me shape and rethink how I'm even talking about PrEP and what PrEP advocacy can look like from the voices and experiences of people who are living with HIV. And so this is my team, the dynamic group. We are ever expanding, and I'm always looking for additional people. If you're interested, you can hit me up. And so to go back and think about sort of this piece of what I'm talking about, right? Why education? What do we know in education? The answer is not a lot. So I looked at all of the research between 2008 and 2018 that was published in higher education journals. I focus a lot on college students, one, because trying to get health information or have any conversations about sexual health and safety in a K-12 school under the current political environment is almost impossible, but something I'm going to leave to someone else to pick up. And so I focus specifically on higher education and student affairs. That's like Greek life, residence life, all of these sort of programs and activities that students are involved in on campus. I wanted to know how those sort of environments and ways of being engaged on campus might shift or impact or influence what students are learning about and knowing. So I looked at every piece of research that was published between that 10-year sort of time span. That's 3.5 presidents, give or take. And I wanted to understand, sort of what are the primary topics, what are the different things that people are doing, and what approaches are they taking? One of my frustrations as an education scholar is that we don't focus a lot on the stories and the narratives and the experiences of people who are living with or working to prevent HIV, right? People who are HIV positive versus HIV possible. We spend so much time focused on the numbers, and those numbers don't humanize the stories and the lived experiences of the people who are behind them. And so I broke all of this down because I had to do the numbers thing, right? It's just a part of being an academic. But I noticed that there's a large overrepresentation of quantitative research. All people are looking for are statistics and numbers. And how do I sort of quantify what people are thinking about or what people know, but not necessarily how they talk about it or articulate it in their own words. There were only 8 studies using people's sort of stories or knowledge or information in their own words and on their own terms. So in terms of the findings, I found that a lot of researchers who are talking about this, whether they're an education scholar or a health scholar, didn't really matter, but they were doing this research where they were conflating sex and gender, which poses a threat for how we understand Black women. Which Black women are we talking about? How many women are included, or what students might be included? They flattened a lot of categories. So everything became white versus non-white. So that makes it impossible for us to disaggregate and understand how information or knowledge or data might look based on different racial demographics. And then most of the articles failed to do any sort of actual analysis where they were looking at, talking about, or thinking about the identities that they collected from people. So we do all of this research. We say, hey, do this demographic survey. And then I don't actually analyze what I found based on any of those demographics. So an overwhelming of what we found is that people are focused on risk and risky behaviors, which students don't respond well to. If you tell someone, right, if we think of a sort of traditional, in quotations, college student between the age and 22, if you start talking to them about risk, they are not going to listen to you. And so there's a disconnect in not only how we're collecting this information, but how we're talking to students about it that could be undercutting our growing efforts for U equals U and thinking about interventions like PrEP all of which led me to wonder sort of, okay, I did this broad analysis. What do we know about Black college women specifically? And so I've started to do that to analyze what's out there. I started with more than 133 articles. After looking through them to see how many actually focus on Black women, I ended up at 9. So there are 9 articles that have been published in the last 5 years that are about Black college women and PrEP specifically. Across the board. This is not limited to education. This is not limited to public health. I looked at every sort of academic, large-scale academic search engine that I could find, from PubMed, Embase, ERIC, PsycInfo, things that I have access to here at the University of Vermont, and the numbers are pretty abysmal. So that has led me to think about the fact that Black women generally aren't in the PrEP scholarship, let alone Black college women. Cisgender women are also excluded from a lot of these studies. I started mine out looking at Black women generally, and then I narrowed to cisgender women because I noticed many studies will say men who have sex with men, and then they'll include trans women, which is a whole different bag of things that we need to unpack and how we're doing some of our research. And there just weren't enough peer-reviewed studies, but there's a lot of dissertations, which also led me to think about, right, in the context of this talk, we're talking about Black women who are leading research on PrEP. We need mentors. We need people to help us move those students who are writing these very powerful dissertations about this stuff from the dissertation stage or from graduation to actual peer-reviewed research where people can gain access to it. So that's sort of where I am. Christian, I promise I got you. The other piece is the documentary short that I'm working on, right? Sex preparation. So in theory, it was going to be a 20-minute short. In practice, we're going to have a short version and an extended version because the interviews were so amazing. I had high school students. I had folks who've been doing, research on HIV for years, women who are on PrEP, all of these people who wanted to talk specifically about this. And I did focus a little bit specifically on cis women, but I also started to think about how do we bridge that divide between cis and trans women? What can we learn from each other in terms of HIV prevention, and what can that do to help save and transform some of our lives? There will be a sneak peek available online at USCHA. Stay tuned for that. So the other sort of work in progress is my major study, the one that is funded by the National Academy of Education. And that's the study I mentioned in Metro Atlanta. And I'm looking at Black college women, right? Their attitudes, their skills, their knowledge around HIV/AIDS, but specifically thinking about biomedical interventions like PrEP and PEP. So I focused on Metro Atlanta for now. This is a sort of stage 1 of what I hope will become a multi-state, multi-institution, large-scale study eventually. But doing large-scale qualitative research is really hard when you're one Black woman without a team. So that goes back to that. If you're looking to get involved, let me know, piece. So I wanted to focus on Atlanta because of the HIV rates in Atlanta, but also thinking about the sort of captive institutions that I have connections to there. And also it's my home, to be completely honest, right? I care about the places that I come from and the places that have made me who I am. And so I'm using Sister Circle methodology, which is an emerging qualitative approach to doing research that pays homage to Black women's unique communication practices. We know if you put 4 Black women in a circle and we start talking, even if we don't know each other, by the end it's going to sound like we've been friends for 10 years. And so what can I learn that's different from that versus a one-on-one interview or some of these sort of structured studies where you're just filling out a survey or you're just checking off a box or doing the thing, right? You put some Black women together and 1, things are going to get done, but 2, a lot of information and knowledge can be shared. And so I'm using that to my advantage to better understand what students from Spelman, Clark Atlanta, Georgia State, and Atlanta Metro think about HIV/AIDS. Because I want to have their own words and their own voices, because again, so much of the work is just about the numbers. So here's the actual flyer for that study. Again, this is part 1. I am hoping to move well beyond Metro Atlanta once this piece is done. There is a bit.ly there that you can use. You can take a screenshot. There's also the QR code. And if you have students or mentees or folks that you know connected to these institutions, please send this to them so that I can go ahead and wrap this up over the next couple of months. I'm hoping as I move towards finishing up the documentary, I'll be able to share both pieces of both of these works together so that they're not sort of feeling like they're disparate or separate. Oh, thank you, Siri. So In terms of collaboration, I'm always welcoming new collaborators. So here's my contact information and a QR code that shows all of the research that I'm working on, which is too much because I'm a overcommitted, high achieving Black woman that I need an intervention on. But I'm thinking about, the need for incentivizing and encouraging new researchers to engage Black women in PrEP. I'm thinking about increased funding for this, right? We know that right now there's a lot of money in health equity work, but a lot of it is going to folks who haven't always done identity conscious research or don't actually care about communities that are impacted by health inequities. They're simply looking for grant funding. So how do we, as people who genuinely do care and have investment in this, actually sort of collaborate together to make some of that happen? So that's me, that's my information. I don't want to talk too much because I want to open it up for questions and comments.
Thank you so much, Britt. That was incredible. And I'm sure there are a bunch of questions that folks might have. So I saw that there was one hand up briefly. If folks would like to unmute their line, and we can take questions that way. And then I know some questions have been getting answered throughout the chat as well. What questions do folks have for Britt or Courtney or Christian?
Well, Nicole, while we're waiting on someone to formulate their question, I did capture two from the chat. One specifically for you, Dr. Williams. Are you interested in Delaware State University? That someone may have a contact in their Women's Senate. So if you're interested in, okay.
Absolutely. So my goal is to try to wrap up my current data collection in Metro Atlanta by the end of September, early October. From there, I'll be doing an extension of my current institution review board protocol so that I can be able to expand across institutions. And I'm planning to go from Georgia up, and then I'll go out. But again, it's just me right now and a couple of graduate students trying to get this together. So I'm hoping to build some connections with people who have interest in this and who can also help to be maybe even an offshoot of this, right? I don't think that I'm the only person or the best suited person to do this in every context or environment. I'm happy to share, this is how I started it if people want to do something else with it or take it and apply it to their own context as well.
Okay. Thank you. And I think this next question is for Dr. Boner. You might have already answered this, Courtney. Is there guidance included in the training on how to approach the subject of PrEP with Black women, tips on identifying women who could benefit from PrEP? And I think that was for the provider study.
Yes. So there is guidance. We provide guidance that's aligned with the CDC recommendations for identifying people who may benefit from PrEP, which really kind of boils down to offering PrEP to anyone who is sexually active. But we do talk about kind of what are some non-explicit considerations that we might want to have for women, specifically if a woman is involved in a relationship, that is characterized by violence in any way. That might be something that we want to take into consideration. And then we also talk about all of that in the context of the historical context of kind of the medical practice among Black women and how that influences the way that Black women may receive information about PrEP.
Thank you. Nicole, I don't see a hand, but I do see a few more questions in the chat. Can we get a list of all the presenters' contact information again? So doctors, well, that feels so good to say. Doctors, will y'all please put your contact information in the chat again so folks can engage with you? And I think that, Nicole, I see two hands raised. Dawn and then Karen.
This is an excellent presentation, and I'm so grateful that I was invited to come. So I'm really glad about that. And thank you so much, doctors, for all of your research. My question is this. Initially, when we first heard of PrEP, we heard that it was only researched on transgender women or born male. So what is the actual research for women, and are there complications with pregnancy?
Brittany, you wanna?
This is so funny. Y'all got the Ed Scholar answering the biomedical question. So no, there are not any sort of indications that women are not able to take PrEP or that it has sort of negative side effects. Obviously, they have to have the same monitoring that we all have when we're taking PrEP. So if you're on the injectable PrEP, that's the every 2-month visit to have your lab work done. If you're taking the pills, it's every 3 months, which I'm on the pills, but trying to get the injectable. We're going to talk. There needs to be another conversation about how hard it is to find injectable PrEP right now. Oh my gosh. So that's part one. So there have been studies that have been done. Women have been participating in some of them. The problem is that I think what happened is because Discovery was approved for people who don't receive transvaginal sex or aren't sexual receivers, because that one specific study excluded women, we've somehow warped ourselves into thinking all of them have excluded women or people who receive transvaginal sex, and that's just not the case. So there are multiple options available for women, for people who are pregnant, for people who are looking to get pregnant, who want to be on PrEP. Those include injectable PrEP and also the daily oral pill as well. Does that answer the question?
Yes. Thank you.
Karen?
Yes, thank you so much. I'm definitely honored also to be in this space of such fantastic women. My quick question is really around mental health and self-esteem, and just acknowledging, based on my experience, that in order for us as women to care for ourselves and engage in prevention measures, we have to love ourselves and feel confident that we are worth the efforts of caring and learning more. Has any of your studies or any of your research been able to touch on that connection, and if it's still there, and just your thoughts about that?
That's a really good question. So I've only done one of my sister circles because I need more participants. But one of the things that did come up with some of the students I spoke with was that there is this sort of sense of, I care enough to learn, or I care enough about myself to think about and learn how I can prevent something. But I also have sort of convinced myself that I'm walled off from this, that this is not something that impacts me, that, you know, even if I learn about PrEP, it's something for other people who are different than me, right? So this idea that PrEP is for people who might be engaged in sex work, or people who are having sex in very different ways than me, but me, myself, I'm safe, which I think goes back to that sort of mental health piece, right? We've convinced ourselves that we live in a certain kind of world, and that's what our lives are like, or this is the sort of universe that we're sort of navigating with, but we don't get to exist in a silo or without any sort of navigation or contact with other people. I think that there are people who are way more qualified to examine some of that. Courtney, I don't know if you have something you want to add, or if things came up in your study, because I'm willing to bet the answer is yes.
Yeah, no, I love the question. And I think that I don't know that we're really even at the point where we can really make a determination about what if women are willing to engage with PrEP, if there's something that's hindering us kind of interpersonally, because really we're just getting to the point where women know that PrEP is available for them. Like in my focus group, it was like the first 15 minutes was like education around PrEP, right? Because women had never even heard of it, or they heard of it, but they thought it was just for gay men or trans women, or they thought it was for PEP. They were getting confused with PEP. So we're, to me, in my mind, we're at ground zero of PrEP for Black women. And so I think it remains to be seen what are some of the mental health facilitators or barriers to women wanting to get PrEP. But everyone in our focus group was super excited about the prospect of PrEP. Particularly if you put it in the context of their sexual universe. For Britain, you know, like, so we talked about a vignette of a woman who's cisgender, has a boyfriend or has a partner, and their partner has another sexual partner, but they're not yet ready to exit the relationship. And we know in the Atlanta metro area that is very common. And so people were like that resonated, and then we continue to talk about it. But I do think we're in the infancy stage of understanding Black women, and just in the awareness phase.
Yeah, I think one other thing I would add to that is, in the process of filming the documentary series, one of the things that consistently came across from the women who are active PrEP users was just how much more relaxed they felt. They felt safer. They felt like they were able to be more intimately connected and sort of emotionally connected to their partners because HIV was one less thing that they had to worry about. And so I think there should definitely be some research looking at what sort of inhibitions this might help to remove for Black women who are looking to be romantically or sexually engaged.
Well, to our audience, will you help me celebrate, thank our presenters on today, because they did such an amazing job.
Woohoo!
Thank you. Awesome. You can use your emoji if you're on mute. We have run out of time, but this was just such a great webinar today. There will be a part 2, September 13th at 2 p.m. And our 2 presenters for that webinar, one name you already heard on today, and that's going to be Dr. Rashida Chandler. And she's going to be talking about her work with PrEP and the app that she's created for HIV prevention for Black women. And then our other presenter is going to be Dr. Marissa Robinson, and she's going to be talking about her research with PrEP on historical Black colleges and university campuses with Black students. So again, I'm feeling all this Black love, and we're honoring all these amazing Black women researchers. There was a question regarding the recording of this. The recording will be available. We will include, we will post a recording on YouTube, and we'll send that link out as well so that you can share it with as many people as possible. Also, you have the contact information from our 3 researchers for today. Utilize it, see how you can support their work and their efforts, so that today's session is more than just what we got from them, but also what can we offer to support them and their work. And then last but definitely not least, thank you, NASTAD, for being our partner for this webinar series. Thank you for all the people that you reached out to and brought to make sure that today's event was a success. Well, this concludes our webinar. And again, thank you to the participants. Thank you to everybody who spent this precious time with us. You all have a fantastic day.
Thank you.